Okay, we already discussed that 9 region of abdomen. Now what we see, the real anatomical pictures of abdominal wall. So this is the abdominal region. Okay, above 2 subcostal plane and downwards there is a inguinal plane. Okay, in both sides. This is the right inguinal region, this is the left inguinal region. So if we say the 9 regions in the real time anatomical picture, so this is the epigastric region, this is the right upper quadrant, this is the left upper quadrant, this is the umbilical region, this is the hypogastric region, this is the lumbar region, and this is the right iliac region, this is the left iliac region. Okay, so these are the 9 parts. Now the abdominal cavity is covered by 8 layers. Outer to inward, you have to answer like outer to inward, skin, superficial fascia, and external oblique aponeurosis, internal oblique, then transversus abdominis, and extraperitoneal tissue, parietal peritoneum. So there are 8 layers, that is skin, subcutaneous tissue, external oblique muscles, internal oblique muscles, transversus abdominis muscles, then extraperitoneal tissue, parietal peritoneum. Sometimes there is an additional layers, that is fascia transversalis, which is not present above the umbilicus. It presents below the arcuate line. I will later discuss on what is the arcuate line is. So in the arcuate line there is an additional layer, that is fascia transversalis. So where is the arcuate line present? This is the umbilicus, this is the symphysis pubis. In between two there is the imaginary plane, that is called the arcuate line. So below the arcuate line, in this region has a special layers, it's called the fascia transversalis or the transversalis fascia. Okay, so you have to answer the layers of abdomen like this. So here we can see the skin, that is the part of the skin which has been cut from here, and the some fat molecules you can see. This is called the subcutaneous tissue, and then the part of the white part and the part of the muscle fibers. So this is the external oblique muscles, but this is the aponeurosis of external oblique, and this is the external oblique muscles. So we can see the direction of the muscles is like this way. All the muscles fibers are goes upwards to downwards from lateral to medially, that is from medial to lateral to medially downwards. Okay, so here it is the aponeurosis, that is a part of layer of the external oblique, that is aponeurosis of external oblique. And the junction between external oblique muscles and aponeurosis, this is called the junction between the aponeurosis and the muscles. So here the midline, this is the midline which is started from gyphoid process, and the here the symphysis pubis located here. So this is called the midline. Here is called the linea alba, that is a folded portion, a thick portion. This is called the linea alba. So first of all, the origin insertion of this muscle. So external oblique muscle, which is originated from upper 4 ribs that is upper 8 ribs. Upper 4 ribs is originated with the fleshy fibers of the serratus abdominis. So you can see the small muscles. This is called the serratus anterior. So this is the fleshy fibers. This is the fleshy fibers from the upper 4 ribs of the serratus anterior muscles, and the lower 4 ribs here from anterior to posterior, there is another 4 ribs. It is called the lower 4 ribs. So these are the fibers of the fleshy slits of latissimus dorsi. You can see a back muscle. It is called the latissimus dorsi. The lower 4 ribs or fleshy slits from the latissimus dorsi. So this is the lateral origins, upper lateral origins. And in the medially upwards, this aponeurosis of external oblique, which is a continuation of the pectoralis major muscle. It is a big muscles of the chest. So the lower part of the pectoralis major muscles, that is the upper costal plane, that is lower 5, 6 or 7 ribs, the slits just along the 5, 6 and 7 ribs, along the costal plane, these external oblique muscle is originated from medially these parts. It includes the gyphoid process, and it inserted downward lateral to medially. Okay, its direction goes like this, like we can put hand to the pocket, the manners. We can put hand to the pocket, these manners. So now this muscle is inserted in the 3 parts. That is, this part of the muscle is inserted in the midline, and in the side of this muscle inserted in also the midline, and in the lower portion, that is here you can see the iliac crest, the bony crest. Okay, and the anterior 2/3 of the bony crest of the iliac bone. So iliac crest, it is also called the iliac crest, and the anterior part forms a inguinal ligament. So this is the inguinal region. So the folded portion you can see here, it is called the inguinal ligament, which is rounded and makes a ligament formed. And the midline, in the midline, it inserted into the linea alba, and okay, that is it. And the internal oblique, if we see the internal oblique in this part, here, see, part of the muscles is removed. That is, the second layer is called the internal oblique. So this is the aponeurotic part of the internal oblique, and this is the internal oblique muscles. So this muscle goes like this. Okay, so external oblique originated from this direction, and internal oblique goes from this direction. So this goes in this direction, and in this side goes in this direction. So this is the internal oblique muscles, which is transformed into the aponeurosis in the midline. Okay, so this is the internal oblique muscle, which is also inserted into the linea alba and originated from the iliac crest and the here there is symphysis pubic and the pubic crest present in the midline just above the symphysis pubis. This is the symphysis pubis, just it is originated from here and here goes upwards, and which is inserted into the linea alba. This is the second layer of the abdomen. Now the third layer of the abdomen is here, the third layer of the abdomen here present. Here you can see the third layer of the abdomen. This is the third layer of the abdomen. It is called the Transversus Abdominis because it is transverse. It placed like this, transversely. So here the transverse abdominis muscle, the third muscles of the abdomen. Okay, it originated from the posterior the thoracolumbar fascia, posterior layer of the thoracolumbar fascia, and the anteriorly the inner lip of the iliac crest. So external oblique is outer layer of iliac crest, and the middle lip of iliac crest where origination of internal oblique, and the inner lip of the iliac crest gives origin of the Transversus Abdominis muscle, which is inserted in also the midline, that is linea alba. So in two sides this internal oblique present. There's two types, oblique present. Okay, now we will go to the midline, that is we will go to the midline. Okay, let's see. Previously this layer is been cut off, so here you can see a long strap muscle, a long strap muscles. It is called the rectus sheath. The part that is been cut off from the covering of the muscle is called the rectus sheath. So rectus sheath has two layers, that is anterior layer of rectus sheath and the posterior layer of rectus sheath. So anterior layer of rectus sheath is the anterior cover of the rectus abdominis muscle. That's why the sheath is called the rectus. So this is the rectus abdominis muscles, here, 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 here. So this is the single muscle, but there are multiple segments. It is called the tendinous intersection. So there is a debate why tendinous intersection present here. Tendinous intersection makes the long column into the short segment of this muscle. So muscle is single, but this tendinous intersection makes the muscle segmented. So the intersegmental area, so that the intersegmental area can perform great or gives more strength in expansion and contraction. So it gives good pressure or force to have the good contraction. So these three muscles, the rectus muscles, function is to hold the viscera protected, and the gives protection from external injury or any blunt trauma, and it helps to bend the vertebral column, and also distension of the helps in distension of the abdominal wall, so that it can easily expanded and release easily. So and this is the anterior layer of rectus sheath. So now the posterior layer of rectus sheath. Here you can see the posterior layer of rectus sheath. This rectus sheath has been cut off. Then we can see the white fleshy fibers, that is called the posterior layer of rectus sheath. So here you can see some blood vessels just under the muscles. It is called the inferior epigastric vessels. So I mentioned the vessels, that means both artery and vein, inferior epigastric vessels, and this is the superior epigastric vessels. So inferior epigastric vessels will connect it with the superior epigastric vessels, okay, not the superficial, it is called the superior epigastric vessels. So that is all. Now the next layer, that is, we have to know this portion has a transverse section, that is how these muscle connected with the lateral muscle. So three muscle, external oblique, internal oblique, and the transverse abdominis, muscles which are connected or enclosing the rectus abdominis muscle. How it forms? It will be formed like this. You can see here the three muscles transversely, that is skin, subcutaneous tissue. So this is the skin, whole part of the skin, and the fat part, the subcutaneous tissue, it has two layers. One is the superficial fatty layers and deep membranous layer. It is also called the fascia of Camper's and fascia of Scarpa. Okay, so here the external oblique, this is the internal oblique, this is the transversus abdominis. So these three muscles enclose the rectus abdominis muscles, and so above the umbilicus or up to the arcuate line, the muscle arranged like this. Okay, so this is the external oblique, this is the internal oblique, this is the transversus abdominis. So external oblique and the internal oblique transformed into aponeurosis. So this white area is called the aponeurosis of the muscles. So external oblique goes upwards and forms the anterior layer of rectus sheath, and the middle internal oblique also makes the muscle enclosed, like one fiber goes upwards, one fiber goes downwards, and forms a linea alba, and then it goes again and forms the anterior layer of rectus sheath. So external oblique forms anterior layer of rectus sheath, but internal oblique so the external oblique aponeurosis forms the anterior wall of the rectus sheath, and the internal oblique also enclosing the rectus sheath and forms the linea alba. So these three muscles all are inserted into the linea alba. So this is the anterior layer of rectus sheath, and this is the posterior layer of rectus sheath. So external oblique forms the only anterior layer of rectus sheath, and the transverse abdominis forms the posterior wall of rectus sheath. This kind of pattern present only up to the arcuate line, and just below the arcuate line what occurs like this: three layers, that is external oblique, internal oblique, and the transversus abdominis. These three aponeurosis just goes above the rectus sheath. Okay, and here there is no aponeurosis posteriorly, just below the arcuate line there is no layers of the muscles. So this is the peculiarity. So here you can see the internal oblique and transversus abdominis goes under the muscles, but below the arcuate line the three aponeurosis goes above the muscles, but there is no layers under the muscles of rectus abdominis muscle. So what is the support of here? You can see there is a gray area. There is a layer of gray area. It is called the transversus fascia transversalis. That I already mentioned that fascia transversalis present only downward to the arcuate line, just below the arcuate line. Fascia transversalis presents only below the arcuate line, and also in the above the arcuate line also, but it will present just below the transversus abdominis muscle. But below the arcuate line, the transversus abdominis goes above the rectus abdominis muscle. Okay, so it must be remembered that transversus abdominis and the fascia transversalis present in the same plane above the arcuate line, but below the arcuate line the fascia transversalis goes only under the muscle, under the rectus abdominis muscle, but these three aponeurosis goes upper part of the rectus abdominis muscles. This is the general importance, general difference between two plane, because it is been invariably asked and the present in the exam, and it will be set in the post graduation exam. So here you can see three globular structures. So there is a three folds. It is another question. Medially in the central plane, it is called the median umbilical fold or ligament, and in between two sides there is a medial umbilical ligament. This is a left sided, this is the right sided medial umbilical ligament, this is the left sided medial umbilical ligament. So medial umbilical ligaments represents the obliterated umbilical artery. So medial umbilical ligament represents obliterated umbilical artery, and the median umbilical ligament, that is umbilical cord, obliterated urachus, that means obliterated umbilical cord of the fetus. And there are a lateral umbilical ligament that will be discussed later on. It is represents the inferior epigastric artery. Okay, here the inferior epigastric artery that we see laterally. Okay, this laterally presents the lateral umbilical ligament, which represents the inferior epigastric artery. Okay, now we will discuss later on about the inguinal region.